So the kidneys play a very wide role in our organ system in the body. One of the main things that they do is being able to eliminate waste. Every time we eat something that can easily build up in our body, there's a lot of sodium and potassium and other minerals in things that we eat, and the body needs to be able to eliminate that in some way. And so the kidneys help facilitate releasing of extra potassium, sodium, things like that. So the other thing is that we also intake a lot of water throughout the day, so the kidney is essential in being able to regulate how much water is to stay in the body versus how much we eliminate. Finally, the kidneys are also essential in helping us with certain hormones that are in our body as well, which help regulate our blood pressure, also with help regulate our blood counts, and finally to also help with our bone metabolism. Nephrology, which is basically the study of the kidney and high blood pressure. So with nephrology, there's a lot of kidney diseases a lot of diseases out there that affect the kidney. The main ones would be diabetes and high blood pressure. In addition to that, any disease that causes blood or protein in the urine also is something that we really like to focus on, because those are conditions that can be treated to try and stop the progression of the disease, as well as diabetes and high blood pressure. In addition, we also help treat kidney stones. And also we treat people that have kidney disease that has failed, and so that we will help them in the future to replace the kidney function with either dialysis or a kidney transplant. So I think most times people, when they get a kidney stone, they're ready to do pretty much anything you say at that moment in time to make this kidney stone go away. What I do is I try to prevent that stone from coming in the first place. And that is really easy to do when someone's having a kidney stone attack. A year down the road, when it's been so long that they've had that kidney stone, it's harder to keep up with prevention at that point. A big part of kidney stones has to do with hereditary. A lot of us don't drink a whole lot of water, and most of us can get away with that. But unfortunately for 10-20% of us, not getting that proper amount of water intake is going to make a kidney stone. So what is a kidney stone? A kidney stone is basically some minerals in the body that our kidney normally just releases, but for some reason our makeup in our urine is causing those stones to come together and finally form something that's big enough that's causing a ton of pain. So a lot of times, just by seeing your physician and getting some urine studies, we can say, okay, this is exactly what is going wrong and what you need to do to prevent further kidney stones from reforming. And a lot of times that just happens to be, well, you need to drink a lot more water. You don't have enough water intake in your diet, because it's kind of like dilution is the solution. If you have a very concentrated urine, those elements are very close to each other, can easily bind. But if your urine is diluted, then those elements can't form together. A lot of other dietary guidelines have to do with a low salt diet, as well as reducing the amount of protein that you intake in your body. Those simple steps can really reduce a lot of the amount of kidney stones that we get. I think our clinic, we really try to focus on establishing a relationship with the patient, where we're not just telling them to do things, but we're more focusing on why we're doing things. And people, I find, are far more willing to accept that and to try and change things when they know why they're doing things. I think a great example is we get some rough characters through here once in a while, and we had a recent truck driver, and this gentleman, he was not really willing to quite do anything, and so we had to have a heart-to-heart of, well, what is it that you do want to change? What do you want out of life? And he wanted to see his grandkids. He wanted to see them grow up. And so we said, well, that's great. We all want that. Let's figure out how we can make you live longer, and even maybe give you a little more energy than you had before you first came in here, to help you play with those grandkids and to see them grow up. And so with that, we're able to start with, okay, well, let's start with diabetes. Let's get our diabetes goals met. Let's get our blood pressure goals met. And we slowly get those under control to where by the end of it, we're helping him to live longer.